Hello, everyone. Thanks for joining us today. We have a lot of great information to share with you and a fairly full agenda, but we're going to try to leave as much time as possible at the end of our presentation to answer your questions. And for those of you, for questions that we don't get to, we will provide a Q&A after that will be circulated for everyone who's attending the webinar today. While we're getting settled, if I could ask you all to put in the chat your name, your organization, where you're located, and one thing that you really enjoy most about working with older adults. And Michelle, if you could pop that slide up, that'd be great to remind people. And while Michelle is advancing the slide, I want to go ahead and introduce myself. I'm Stephanie DeCicciolo. I'm a vice president here in the Solutions Division at Enterprise. I'm joined today by two of my colleagues, Mary Ayala, a senior program director with our national programs team, and Michelle Smith-Napier, who works with me on our evaluation team. So thanks to both of you for being here. I think Mary's going to kick us off with a few housekeeping items. So I'm going to turn it over to her, and I'll be back in a minute. Mary?
Great. Thank you so much, Stephanie. And it's so great to see so many folks on the line and introducing yourselves. I look forward to looking through all of your responses. But we're just so excited to be here today to speak to you all about this grant opportunity, and wanted to remind you of a few technical reminders before we start. One, this webinar is being recorded. So just be aware that all of the chat messages and anything that is said today will be within the recording. If you would like a copy of the recording, please send a request to us at agingwell@enterprisecommunity.org, and I will share that email address in the chat afterwards. Additionally, we are happy to share slides with all the attendees who are participating in the webinar or registered for the webinar today. I know that's a question that always comes up. And lastly, we plan to answer all questions at the end rather than throughout the webinar today, but we do encourage you to go ahead and pose your questions as they arise and as you're thinking about them. So you will see that there is a Q&A function in this webinar, and we encourage you to use the Q&A box to pose questions to Stephanie and myself rather than the chat, because we know the chat can sometimes things can get lost in the chat as we all connect about different things. But if you would like to speak to anything that's being said and you want to share it with the larger group, feel free to put those thoughts in the chat, and we'll reserve the Q&A just for questions regarding the grant opportunity. And I think that's about it in terms of technical reminders. After folks are finished introducing themselves, I am going to put a couple of just really important links for this grant opportunity in the chat so that you all have easy access to them, but hopefully they are resources that you're already familiar with. And with that, I'm going to hand it back to Stephanie to do an overview. We're probably going to go off camera for now and come back for the Q&A. So thank you all so much.
Thanks, Mary, and thanks everyone for putting that info into the chat. I can see it going, and it looks like we have a good representation from both states, at least from what I've been able to see. Michelle, if you could go to the next slide. I thought before we got started and really talking deep about the RFP, it might be helpful to go over and provide you with a general overview of the Thome Aging Well program. Just waiting for the slide. But anyway, let me go on just to say that the grant opportunity is just the start of a 4-year program that seeks to improve the health and well-being of older adults with low incomes who are living in Michigan and Maryland. And I want to give a special thanks to the Edward N. and Della L. Thome Memorial Foundation, who has funded the Aging Well program. And we are obviously very grateful for the deep commitment that the foundation has shown over the years to organizations who are helping our older adults age with dignity, surrounded by a supportive community. So thanks to the foundation. Next slide, please. As we began to design the program, we were really guided by 5 principles that you see on this slide. The first principle was really to honor Mr. Thome's legacy. And I know from some of the questions that we've already gotten from some of you, you all have already been beneficiaries of the Thome Foundation. We've had several inquiries around from organizations that have already received grants from the Thome Foundation. And that was great to see and great to hear. And just to let you all know, we are determined to continue his legacy through the Aging Well program. And were his wishes, we are focusing the work again in Maryland and Michigan. One thing we wanted to be sure with the program is that it has a resident focus and a way to actively engage residents in the learnings that we're having, in understanding their priorities and their needs in a more fulsome and intentional way. And so we're really thinking of ways now that we can actively engage those residents as our program grows and evolves. Our grants will support organizations such as yourselves who are delivering direct services and healthy housing improvements for older adults to allow them to age in their homes. That's a huge emphasis of the Thome Foundation, and obviously an emphasis on our work in the Aging Well program. And then finally, we wanted to ensure that as we were doing all of this, we never lost sight of the need for sustainable funding for this type of work and demonstrable impact. And so built into our program, as you'll see in a minute, are some ways that we hope to lean into that guiding principle. Next slide, Michelle, please. So we have 2 goals for the program. The first, as I mentioned before, is to really improve the health and well-being of low-income older adults who reside in Maryland and Michigan. But the other goal is equally important, which is to drive innovative strategies that are aimed at improving the ways in which we care for older adults in this country. And that may not be just lower income older adults. We hope to have learnings that can be applied across the board to all of us, I should say, who are aging in this country. So both to continue to work on this generation of older adults, but also to drive strategies that will hopefully improve circumstances for those as we continue to age. The program has 5 basic elements. The first element is where we are today, which is the Scale What's Working grants. And that is really about looking at how we can help you all continue the good work that you're already doing by increasing your opportunity to go deeper in that work, to extend that work to other residents, other parts of your portfolio, et cetera. We also want to incubate new ideas. And so we have a program element that's focused on innovation and demonstration. We're learning we want to share the learnings that we have across all the grantees within a given state. So we have state learning collaboratives and a partner network established. And then again, towards sustainability, really allowing you all to share your successes with those who are in a position to fund the work beyond today's grant and into the future. And then finally, along all of this, we want to be sure to evaluate what we're doing and to disseminate those findings beyond just the grantees that we have in the Thome Aging Well program, but to those who are working in this area across the country. And so that's a lot, and we're excited about the program, and we're excited that this is really the kickoff of what we hope to be a very impactful and meaningful exercise in really helping us understand the needs of older adults and how we can support those needs as they continue to age, allowing them to stay in their homes and in their communities. And the last slide I'm going to share is really around the overall time frame, just so you have a sense of what the 4-year program is going to look like. So, Michelle? So you can see right here, we're in year 1. The program just has really kicking off today with this first RFP around the Scale What's Working grants. And those will run in 2 rounds, one in this year and one in year 3. We have the incubation and innovation grants starting in at the end of year 1 with a series of incubation grants that will go out. And then later, a subset of those grantees will receive larger demonstration grants. We have the learning collaboratives probably kicking off towards the end of this year to allow the grantees to, get some work under their belts and be able to come and share what they're learning. Funders convenings in year 2 and 3, years 2 and 4. And then, as I mentioned, going throughout the program, evaluating what's happening, lessons that we're learning, best practices that we're pulling out, and making an intentional push to disseminate those findings out to the broader field. So with that, I'm going to stop talking. That was a very fast overview of the program. Some of this information is contained in the RFP. And I'm going to turn it over to Mary, who's really going to talk to you about the current grant opportunity. And just as a reminder, I'm sure this overview probably created some questions in your mind about the overall program. But on today's webinar, we really want to focus questions on the current RFP, the current grant opportunity. So Mary, I'm going to turn it over to you to kind of go through the details of that grant opportunity. Thank you.
Great. Thanks so much, Stephanie. And Michelle, if you want to advance to the next slide. So we are, as Stephanie shared, we're just very excited to be here with you today and to launch this first opportunity around the Thome Aging Well program. And one of the things we know and wanted to acknowledge when when Enterprise was developing this program was that there are already so many great programs that support older adults' health and well-being through housing-based services. And so many of you all who are joining today are already doing this important work. So within our work and speaking with folks, both in Michigan and Maryland and around the country, we've heard amazing stories of programs that support the physical health of older adults through on-site services, programs that empower older adults to be active in their community, that build on the strengths of the community members that they are serving in creative ways to support the physical, mental, and financial health of their residents. And even with all of these stories, one thing that we're very aware of is that these programs aren't reaching all the people who would benefit from them, especially low-income older adults. And so that's why we've worked for the first grant round to really move to impact in a quick way to scale what is already working in community. And so the purpose of this first round is really to scale proven housing-based services and supports that enable low-income older adults living in Michigan and Maryland to age with dignity in their homes. And I'll touch a little bit further on exactly what we mean by all of these terms, from scaled to proven and housing-based. So, but first we just want to start with the basics. That is that these grants are meant to have a period of performance of 24 months, and that in those 24 months, we've tried to build an award that will move the grantees towards more sustainable opportunities and ability to implement these programs. And so for this reason, in addition to the monetary award, we've integrated other aspects that Stephanie has touched on, and I'll go into a little bit more detail on. But to just start with the basics, the award amount for these grants is between $150,000 and $300,000. We encourage you to size your proposed program to the needs that you have within this range. However, we do anticipate that the average award size will be $250,000 per grantee. We have up to $4 million to be awarded this round, and are excited to see the programs that come in for applications. In addition to the monetary award, Enterprise will be creating state-based learning collaboratives for grantees, and these will kick off at the beginning of 2023 and will meet quarterly. We anticipate that there will be 3 virtual sessions a year and 1 in-person session to allow grantees to meet with each other, to network, to share learnings, and then to collectively problem solve. We anticipate that the curriculum will be co-developed between Enterprise and the grantees themselves, and additional grantees will be joining the collective as additional grant opportunities are opened up. So the pool will be kind of your network of peers will be growing over time as well. A third component that we are really excited to offer is an opportunity for a third-party evaluation group to work with us and offer grantees up to 15 hours of in-kind assistance around their evaluation needs. This is something that the grantees will, it'll be an optional component of the award, and it'll be shaped to the needs that the grantee has. So you might be interested in using this TA to help shape a theory of change for your program, or think through new data collection methods, or even work through how to better communicate your impact and findings to attract additional funders in the future. So we're really excited to see the different needs that exist in the way that this TA is used, and we'll be using that information to help inform future grant opportunities as well. So the last piece of this is, although we know that $250,000 offers great opportunity, and that we do hope that it can build sustainability within your programming and your program offering, we know there may still be fundraising needs at the end of this period of performance. And so that's why we'll be designing a funders convening in collaboration with the grantees to be able to share their story and network with additional funders in the field to really make the case for the continued need for this support over time. Okay, so we can now go to the next slide. And we are transitioning to some of the more technical pieces of the RFP, including eligibility. And first things first, we're looking at 2 different types of applicants, one being an organizational applicant and one being a consortium of organizations. So in other words, a larger partnership. We, in both cases, the applicant that's submitting the application will need to be a nonprofit owner and/or operator of affordable housing, housing authority, or tribal designated housing entity. For the consortium, you may see that the housing organization is the applicant, but that you can work with direct service providers, healthcare organizations, or mental health providers, and integrate the roles that the different organizations will play throughout your application. In both cases, all applicants must serve low-income older adults in Michigan and Maryland. Low income is being defined as 80% of area median income or less, and older adults is being defined as 55 years or older. All applicants must also provide direct services or directly contract with a service provider who provides direct services to low-income older adults in a housing setting to support their physical, mental, or financial well-being. All right. And just as a reminder, feel free to put your questions in the Q&A box as they come up, because I know that these are probably the areas where most of the questions will come in. All right, and 2 notes before we move to the next slide. One is just that your organization does not have to be headquartered in Michigan or Maryland, but the residents that are served in the proposed program must be living in Michigan and Maryland. We do not have a set number of grantees that will be granted in each state. So just for example, if the top applicants have 10 grantees from Maryland and 6 from Michigan, we will award that as such, and vice versa. All right, and moving on to the next slide, Michelle. Okay, so within the eligible programs, the program focus must be on the physical, mental, or financial health and well-being of older adults living in affordable housing. So in the case of this grant, we're defining physical health as the physical ability to perform daily activities, manage chronic conditions, achieve proper nutrition, limit drug and alcohol use, sleep, or be active. Mental health is being defined as the promotion of psychological, emotional, and social well-being, and may be inclusive of social connectedness, self-esteem, stress management, and management of mental disorders or early warning signs. In terms of the financial well-being of older adults, this includes the ability to maintain financial stability, including increasing financial security, connection to benefits, workforce training, or financial planning and education. We don't anticipate that any particular program is going to necessarily serve all three of those needs, and we will consider topic-specific focus areas as long as they fit within those categories. In terms of population served, I've said this a few times, but just to reiterate, as I think it's extremely important, the population that will be served are older adults that are 55 and older, have low incomes defined as 80% of area median income or below, live in Michigan and Maryland. We will be giving priority to programs that are serving folks who belong to communities or groups that have experienced persistent health inequities. So this includes Black, Latino, and Native American populations, as well as populations with extremely low incomes, persons with disabilities, and members of the LGBTQ community. Lastly, these dollars are primarily focused on implementation and not a long planning or assessment period. So if you're really thinking that you are needing a long planning phase or a planning type grant, you may want to consider waiting for another round of funding. We're asking that applicants that are applying for this round be prepared to begin serving your population with the proposed services within 6 months of receiving this grant. We hope this is a good balance in implementation and the time necessary for any additional resident engagement, hiring, training, or other logistics that are needed for launch. All right, and we can move to the next slide. Great, so in terms of these next two slides really focus on the terms of scale and what we're considering proven programs. So the first type of program that's being considered is the expansion of an existing program. And this really means the expansion of an existing services program that your organization already has in operation, but that you're looking to expand kind of who that serves, how many folks are touched, or adding a higher level of services. So I think that this can take a lot of different forms and may include, for example, if you have a services program that has a proven impact at one of your properties and you've been looking to expand it to more properties in your portfolio, this would be a good use of the expansion of an existing program. If you have a multifamily property and typically have kind of had a family-focused resident services program, and you're looking to have a more targeted services program for your aging and older residents, that could be a good use of this program, of this type of expansion. All right, so as the program goals state, we're asking for some illustration through an evidence base that your program has an impact and has been proven to work in this population. However, we're very aware that evidence base can be hard to come by. And so we've tried to design this program to have a flexible approach in how you can illustrate the impact of your program. And given, or for this scale type of expanding an existing program, we're asking for two types of evidence. One being qualitative illustration of program impact. This may include case studies if you have already developed those, or program and participant narratives or testimonials that you can submit alongside of the more quantitative data in terms of an outcomes data or program performance data. So when we're referring to outcomes data, we're actually looking to see, the outcomes, the health outcomes that are related to the program implementation. So that might be self-reported health status. It might be improvement in compliance with a medication plan or increased amount of savings that a resident has. But alternatively, because we know that outcomes data can be difficult to find, you can submit the qualitative data alongside program performance data, which would be more along the lines of how many residents have participated in your program on a regular basis? How many resident touch points have you had? How many different trainings have you provided? So if you have questions around this, please reach out to the inbox as stated, and we will, and there's opportunity within the application to attach up to 3 different attachments to illustrate this evidence base. Okay, and so we can now move to the second type, which is the opportunity, and Michelle, do you mind advancing the slide? So the second opportunity is to scale a proven model. There's a lot of well-researched and well-studied programs or program elements that have illustrated impact for this population in a housing setting. So we encourage you to also apply to introduce a new proven support or resident services model that has not already been adopted at your property. For today's call, we're not necessarily here to answer any specific questions around specific models that will or won't be supported, but we ask that you submit your evidence base in your application. And the evidence base that will be considered alongside of this type of application are white papers, outcome evaluations, scientific literature. So more information that is out there to really illustrate that we know that the physical, mental, or financial health of older adults are impacted by this type of program or these program elements that you're proposing to be adopted at your property. Okay, thanks for bearing with me through all of this. I know that this gets a little bit more technical, and we can move to the next slide. So after receiving the grants, this slide and in the RFP, you can look for more of the expectations of the grantees. So of course, we are looking for grantees to execute the proposed program that they apply for. And we're asking for annual reporting, which will end up being a midterm report and then a final report, since this is a 24-month grant. And one thing that we're really excited about is that we'll be bringing on local program directors to work directly with you around your grants and in the learning collaborative setting. So we'll be asking for quarterly check-ins with the local program director, who you'll get to know and who will really be there to help support you all in navigating the annual reporting and putting together the curriculum for the learning collaboratives and connecting you with the TA for the evaluation. So from there, we also ask that grantees participate in as many of the learning collaborative meetings as possible. And then lastly, for the last 2 points, we're as enterprise looking to really work with you all to see how the lessons learned, the outputs and outcomes from this grant process can move us towards longer term change in the field. And so for that reason, we'll be working alongside of you all in assessing key outputs and outcomes with the evaluation consultant, and then gathering lessons learned to inform the field at large. Okay, and we'll move on to the next slide, which I believe is one of the last. And this is the timeline. So the request for proposal was released on March 31st. and we are offering around a month and a half for folks to get the application together and submit the application in Slide Room. The link I provided earlier, it's a little bit higher up in the chat, and it's also on our landing page. If you have any trouble with Slide Room does have their own help desk, and that information is also provided in the RFP in terms of who you should reach out to. One thing I do want to remind folks of is that there are attachments that are requested as part of the application. So please do not wait until the last few days to look at what the application questions are and what needs to be submitted, because we want to make sure everyone has ample time to prepare that documentation. What we are looking for in terms of attachments will be the budget template, documentation of your indirect rates if you have them, and your evidence-based attachments, which I spoke about earlier, 501c3 letter of determination, audited financial statements, and a certificate of good standing. All of this and the details around why we're requesting those are outlined in the RFP. And I do encourage you all to reach out if for some reason it is not going to be possible to obtain any of those documents ahead of the May 16th deadline. We are also offering 2 additional virtual office hours in addition to this webinar, where Stephanie and I and possibly other team members will be available to just do kind of a Q&A only session, and we won't have the formal presentation like we're doing today, but we'll just be there for you all to drop in as you're able to, and we can answer questions. Of course, we won't be able to answer any project specific questions, but we can answer like general questions about the application process and the RFP. Once all applications are submitted, Enterprise is gathering a kind of cross-enterprise team who will be reviewing and scoring your applications according to the points that are outlined in the RFP. And if needed, we will be reaching out to applicants between June 15th and June 22nd for any clarifying questions that we need to properly assess your application. We want to just reiterate that we will not be reaching out to everyone. And if we do reach out to you or do not reach out to you, it is not an indication as to whether or not you're advancing in the application process. It just is indicating that we wanted a little more information as we assessed the final scoring. And lastly, our goal is to have a notice of award out by the end of June so that we can all get started on this work together. So we can advance to the next slide. Okay, I think we have left ample time for lots of questions at this point. And I'm hoping, Stephanie, you've perused a few of them and can get started with the first 1 or 2 as I catch up on the chats. And Michelle, feel free to go ahead and take the slides down, and Stephanie and I will come back on video. All right. Oh, and you're on mute, Stephanie.
You would think after 2.5 years, I would get the hang of the mute button. But anyway, yes, there are a number of questions. So let's start with something. The first question that came in was really around defining housing setting. Mary, when we talk about housing setting, can you share our thoughts about what that is?
Sure. Yeah. So this is really meant to serve folks where they live. And so by housing setting, we do not necessarily mean that it needs to be within units or within the housing unit, although it can be. But we do anticipate that that the programs that are offered here will be within the housing developments and housing. I'm trying to think of another word other than housing, like where the older adults that are being served either live, or if you are choosing to serve your larger community, we're seeing that as being within the community rooms or within the programmatic space that might exist within your housing development that is in the community that you are serving. I hope that clarifies.
Yeah, it's most important that those services be provided to people kind of where they are. They are based in that housing setting, versus like a clinical setting. I think that's a good sort of a good contrast when you think about that. We have another question about defining what we mean by operator of affordable housing.
Mhm. So in this case, we are typically referring to community development organizations. And we have limited this to to nonprofit organizations. As mentioned, it's also open to housing authorities and tribal designated housing entities as well. If you own and operate a large amount of affordable units. And I'm trying to think if there's a scenario, Stephanie, that we're not considering within this. But if you own and operate a large amount of affordable housing, so housing that is under like LIHTC units, or your organization has chosen to target lower income individuals and maintain that affordability over time, we'd be happy to speak with you about your organization and ensure that it aligns with what we're considering in this case as nonprofit affordable housing owners and operators. Anything to add there?
No, I think that's right. And any questions you have about your eligibility, just again, shoot us an email through the Aging Well mailbox, and we'll track it down with our, we'll get a more learned opinion than Mary and I on that eligibility. We have another question about, can you be a nonprofit and contract with an operator of affordable housing, or does your nonprofit have to be an operator of affordable housing? So for this grant opportunity, you do need to be an owner-operator of affordable housing, or the eligible groups. It's possible in a future round we may extend grants to those nonprofits who are organizations who are serving communities living in affordable housing, but right now the applicants have to be affordable housing owners or operators, public housing authorities, or TDHEs. Next question, most applicants only serve those 80% AMI or less and 55 older for all of their organizational needs, or just for services provided within this grant proposal? So go ahead, Mary.
Just for services provided within this grant proposal. So the population that you will be serving needs to fit that description.
Right. And I think Mary, I think you gave a good example where you may be an owner or operator of a family property, but you have a subset of your residents that are now aged 55 or older and have a different set of needs. And so this grant, if you were offering programming that would target that particular group within the context of a family affordable housing property, that would be fine, and that would be eligible. Exactly. If a consortium applies, is the average award expected to be 250 per org member, or 250 total for the consortium? So I'm going to say 250 for the consortium as a whole. And remember, the range is 150 to 300. But that would have to be distributed across however members of the consortium came in. And just as a reminder, again, the applicant for representing the consortium must meet the eligibility criteria of being an affordable housing owner operator, public housing authority, and TDHE. I am hoping you can give us an idea of when and what kind of focused future RFPs in this initiative will have. One of the things that I think is great about the way we've structured this program is to learn as we do. And so this first grant opportunity will give us a lot of insight, I think, into what the needs are in the field, but particularly for residents of Michigan and Maryland. And we will be structuring future RFP rounds based on the knowledge that we gain through this first round and then subsequent rounds. What I can say is we know we'll have another round of Scale What's Working. It may not look exactly like this. We may have different eligibility criteria, so nothing to count on there, but that will come. There'll be a second round there. We will have a round of incubation grants, which are smaller grants that will allow people to develop an idea. And then there'll be a subset of those incubate awardees that will be granted a larger grant to allow them to pilot their idea. But that's down the road. And we really want to take advantage of the lessons and the learnings that we'll have in this first round of grants before we fully commit and shape what those future grant rounds will be. But there will be additional grant rounds for sure. Okay.
Just to add to that a bit, if you don't mind.
No, please.
Yeah, because I am seeing a couple of things in the chat as well that address this. A few things that we're considering for round 2 of Scale What Working does include how we can reach more of the single family homes, because we know there are great models out there. As mentioned, if you have a development or a property within a community and aim to expand a services program to the community, that may be a way that you could get at serving community members that are within single family housing, but that is something that we're considering for future rounds. And then secondly, I think I saw a comment or another thing that we're considering are just the built environment properties that support people to age within their homes. So that is another area that we're looking further into that is somewhat limited in what you can do in this RFP as you'll read through it. So those are just 2 things to consider. And I think that the big clarity around the Scale What's Working is like things that we already know work and have an evidence base around it, versus incubate are things that you've been thinking about, that you've been working with a lot more partners around, that you've been wanting to test out, but need some initial kind of evidence base to illustrate that it can work and move us towards larger scale systems change there. So just a couple of clarities on that.
So a couple of questions around slide room. Does the application allow us to work on it a little bit at a time and save our progress before submitting? And I think the answer is yes there.
Yeah. Mm-hmm.
The second question I see about slide room is, if we've used slide room for other grants, do we use that same login?
Ooh, I think it's a question for slide room, but I don't think that you should.
Yeah, I'm not sure about the answer to that either. So you might reach out to the slide room help desk to see what they say about that. Okay, I think you addressed the one about the property. Will reviewers take into account geographic regions served within the state for wide coverage? I will say when we were planning the program with the representatives from the Thome Foundation, one of the things they really wanted was to make sure that we hit those areas with the highest need. And so we will be looking for geographic distribution, particularly around high needs populations. Mary, did you want to add anything to that?
No, I'm actually trying to catch up with you, but I'm a little lost on the.
Okay.
Are you on the chats? But so no, I think you.
Yeah, I'm going through the chat because most of the questions came in. So okay, it must be tied to a physical affordable housing community. That's correct. The programming must be tied to a physical affordable housing community or the surrounding community, right? If awarded the grant, will it allow for a dual services approach, i.e. a nutrition program and a physical therapy program?
Definitely.
Mm-hmm. Yep.
As mentioned, we've listed the services provided must fall into the physical health, mental health, or financial health buckets. You're welcome to offer services that take on all 3. You're welcome to do mental and physical. You're welcome to get even more specific and say this is a nutrition program solely, and then make the case for why your population needs it and the impact that it's going to have. But it has to just at least group up to those 3 categories.
Okay. So I think we answered the next one about serving individuals in single family homes. Can the grant be used for program staffing?
Yes, I can.
The only thing I would say about that, and this is just a caution for you all, is the grant is a 2-year period, and we will be asking for your plans on sustaining whatever programming, staffing, et cetera, you plan to do with the grant. So we just know that, you know, we're not a quick, hopefully not a quick fix for you all. We tried to make the grants sizable enough to give you all the ability to have substantial impact and some time to be able to think about how to continue the work after this grant has ended. Are all the Thome assets now moved over to Aging Well Initiative except for medical research? I think that's a question that we can't answer. And so I'm going to leave it at that. Can model be based upon the HUD service coordination model, which is not funded for LIHTC tax credit properties? I think we said we weren't going to get into any specifics around a particular model. So I would just encourage you to apply with the best evidence base that you have. Mary, I don't know if you want to add to that or not.
No, I think that's right. And that's just because we're well aware that we're very familiar with some models and we're not with others. And so we just generally don't want to speak to them because we're going to try to assess them all fairly.
I'm just scrolling back through the chat to see if I missed anything. I don't know if you want to pick up with the Q&A if there's anything different.
Okay, it looks like the first one has already been answered. Sorry. Okay, so just to reiterate, because I do think that this is seems to be a little bit confusing. We are asking that there be a housing hub, a property hub, and that can be, you know, a housing authority's property, a affordable housing property or development, or the tribally designated housing entity, and sorry if I got that acronym wrong, development. But within that, in a lot of cases, we know that folks have the opportunity to serve as a hub within the community, to offer nutrition classes, cooking classes, food, you know, connection to food. Those are the ones that are coming to mind right now, because some of the things that arose during COVID, but to really serve as a place that can support the community at large when it is based in a community that has a similar need to the residents that are living within the property. And so you are in that case allowed to serve your surrounding community as well as the residents that are living within your property. And I hope that that clarifies that, because there's been a couple of questions on that piece. And can you define the term that support structure? Okay, so there's just one question around eligible costs and whether or not it can include equipment that would be used for each senior space. So I'm hoping that I'm understanding this correctly. We have a full list of eligible and ineligible costs in our RFP, and we do limit any physical improvements to the property, I believe, to 10% of the total program cost that you're applying under. Let me just make sure that that's the case. It may be larger. Okay, no, we've limited it to no more than 25% of your total budget. So there is some level of flexibility for you to improve your building or your building space to actually be able to you know, deliver the services that you're proposing. This is more of a services-based grant, not necessarily meant for built environment or aging in place upgrades, but we acknowledge that, you know, sometimes there's need to create more private spaces or create more accessible spaces, create more healing centered spaces so that there's more uptake of your program. And so that's why we've allowed the up to 25%, but it wouldn't be a great alignment. It's focused more than that on the actual built environment. As mentioned, we do hope to allow for those opportunities in the future. So more to come on that. Those are the questions I have in the Q&A.
Okay, a link to the RFP. We did provide early on a link to the RFP in the chat. If you scroll up, you should be able to find it.
I can throw it back in there too.
Another question. So around the housing setting, our work involves doing aging in place home repairs to single family homes across our city, but not owned by us. Would that be allowed, or does it need to be an intervention within the property that we own?
It will need to be an intervention in this case in the property that you own. As mentioned, it is something that we're considering in the future. So we also welcome the opportunity to speak more with you about the needs and how we can shape that moving forward. And I put the landing page back in there, and I'm going to now put a quick link to the actual RFP. All right.
I'm not seeing anything else. If by some reason I missed your question and you still want us to answer it, just if you could put it back in the chat or in the Q&A, that'd be great. I think I got through all of them.
Great. Right. Well, this looks like another one's coming through, but this has been great questions, and we're excited to see so many interested folks on the line, and
Yeah.
really, really excited to see the applications that come in. And, you know, we truly hope that if this particular grant opportunity doesn't align exactly with your programming, that you that we're still able to link up about the important work that you're doing, and seeing where there are partnership opportunities in the future. So
yeah. And just to reiterate, thank you all for joining. We are super excited about the program and the potential it has to not only just scale the great work that you're doing, but also to kind of contribute to the national conversation around what is it like to age in America. And so this is exciting for all of us involved, and we look forward to reading your applications, and thank you for the great work that you're doing. Don't forget, we have office hours again in I guess next week, right? The 26th. If you have any questions that we weren't able to answer today, or that have occurred to you as you are proceeding through the application process, just join Mary and I. Will be hanging out, and we'll welcome you with your questions next week. So unless there's anything else, I think we can, looks like everything is quiet. I think we'll just go ahead and sign off a few minutes early.
All right.
Thanks again, everyone.
Thanks.